Asymmetric tonic neck reflex. It's a primitive reflex, birth to 6 months. While laying on back with head turned to one side, opposite arm and leg should be bent. Babinski reflex, primitive, birth to 5 months, extension of toes. Crawling reflex, birth 3 to 4 months, voluntary creeping movement. Head and body righting reflexes. The head rights itself with the body when body is turned to one side. Labyrinthine reflex, head tilts in opposite direction of body tilt. Lifespan reflex, reflexes that last throughout life of healthy individual, like for example the knee jerk. The Moro reflex causes arms and legs to extend out, not bend. Precedes startle reflex. The Palmar grasp reflex is occurrent in birth to 4 months. Voluntary reaching and grabbing. Palmar mandibular reflex makes eyes close, mouth open, and head tilt forward, also called Babkin reflex. Palmar mental reflex, facial response to base of palm touching, lower jaw opens and closes. Parachuting reflex, propping upright posture, conscious attempt to break, potential fall. Plantar grasp reflex, grasping a toes, example is a touching of the foot. Postural reflexes provide automatic movement that is practiced for future voluntary movement. Primitive reflex profile, tool to examine status of infant reflexes. The primitive reflexes are used for protection, nutrition, or survival. Pull-up reflex, when tipped backwards, the baby will flex its arms to attempt to maintain upright position. Search reflex, helps baby locate nourishment, turns head toward food. Startle reflex, rapid change of head position, arms and legs flex immediately. The stepping reflex is when there's pressure on the foot on a surface, and it stimulates the legs to perform a walking action. Stereotypies, characterized by patterned, stereotyped, highly intrinsic, and involuntary movements of the body. Subcortical are involuntary movements. The sucking reflex, stimulated by touching of lips, occurs pre and postnatally. Swimming reflex, when the baby is held in a horizontal position, the swimming-like movements occur. Symmetric tonic neck reflex, limbs respond symmetrically, sitting position, tip forward, neck and arms flex, and legs extend.